Hello everyone, this is Dr. Brahim. Hope you are doing great. In this video, I will talk about the IPS. As you know, PLAB 2 exam has three domains, which is the data gathering domain, the IPS, and the management domain. It's very easy to know that the data gathering part is the part that you need to collect data, to gather data from the patient through taking history from the patient, through doing some examinations, through requesting some investigation. So the aim at the end is to collect data from the patient, okay? And the management part is very clear to give a diagnosis. It could be provisional diagnosis or confirmed diagnosis if it's a counseling station. And to set a plan of management, it could be you will admit the patient, you will discharge him, you will refer him, you will start him on a treatment, you will do some lifestyle modification, you will involve another specialty to review the patient. So there is many ways that you will manage the patient. And also in the management part, it might be some sort of breaking bad news, telling the patient that there is medical error happen, according to which type of station is it. But the IPS part is not like a separate part, like the data gathering or the management part. It is the interpersonal skills, which is spread all over the data gathering part and the management part. I mean by that, you will collect the marks of the IPS from the management and from the data gathering at the same time. So what is the IPS? It is the interpersonal skills. How you will tackle the station in an appropriate way. Okay? Like during the data gathering part, I will try to give some example in this video, and later on we will make small videos about many tips and advice about the IPS. Like in the data gathering part, how to take history from the patient in an appropriate, suitable way, nice way. Okay? There is many ways to ask the same questions. Like I might need to ask the patient about something, and there is many ways to formulate the question itself. And there is appropriate way to ask the question, and there is inappropriate way to ask the question. So the IPS is how you will gather data from the patient in a very nice, good way. Okay, so how you deal with the patient himself. Okay, how you will show your professionalism. Okay, how you will show your knowledge, how you will show your that you are a safe doctor, that you care about the patient, how you will avoid to deal with the whole situation as an exam. It is not exam. It should be it should be a real situation, and you should deal with the whole situation in PLAB 2 exam as a real situation. Okay, so you need to change your way in dealing with the patients. Okay. Like as I mentioned before, it is not oral exam. You didn't came today in the exam to give the medical information. They know that you know the medical information. Most people enter this exam already know the medical information. But the point is how to deliver this medical information to the patient. Okay? How to follow the patient. How to not to interrupt the patient. Rarely in the exam they might bring a talkative patient. It's not all, very rare they will bring it, because they know that the exam is 8 minutes, and they know it is even difficult if the patient is cooperative to finish everything in 8 minutes. So it is very rare to bring a talkative patient. Even if the patient is talkative, you need to control the situation, but also in a nice way. So I usually say it is balance between thinking about the score itself and thinking about how to be nice with the patient. Because if I thought about the score only, so I will keep talking, keep interrupting the patient, keep pushing him to answer the question I need to answer. Like sometimes the patient will stop you, doctor, but I'm concerned about that. Okay, I will come back to your concern. Let me ask you a couple of questions. Sometimes it's okay to answer the question directly without to address the concern directly without asking question. I know that the script usually says this, but you don't need to follow the script all the time. Even if you need to follow the script, make it in a good way. Like, okay, yeah, actually, this is a valid concern, but I might need to ask you a couple of questions to be able to answer this concern. Is it okay to go for it? There is many ways, not only this way. There is many ways according to the situation itself. Okay, so reflect on the patient. Usually reflect on the patient. Yeah, yeah. It's important to ask this question. Yeah, you need to know this information, like according to the situation, and also you can answer the concern as I mentioned. You don't need to wait until the like 2 minutes or 3 minutes or to take a full history from the patient. Sometime the patient will insist to know the answer, or sometime he will give you a reluctant attitude if you did so. So usually it is human factor, and it will depend on your sense, how is the situation itself. Okay. um, Even sometime in difficult situation like breaking bad news, and it's not advisable to break the bad news in the start of the station to gather some data, and after that to break the bad news. This is the suitable way, but sometimes the patient will insist to know the news before taking some history from him. So it is his right. It is his right or her right to know the news. So it is not appropriate to tell him, no, I just need to ask you a couple of questions. Just bear with me. Yeah, do it 1 or 2 times, but don't push the patient to wait, or don't force him to wait until you ask your question. Okay, it's full right to know the answer. And actually, he came at this day. If it is a test result or a breaking bad news, he came only to know the answer. He didn't even expect to be asked too many questions. And actually, in such a station, you don't need to ask too many questions to the patient. Okay. So in such a situation, you can give the answer. Yes, I know that the situation after breaking a bad news in the start will be difficult, but you need to learn to teach yourself how to control your nerves, how to control the situation if you give the bad news at the start of the station. Okay. Also, sometimes the patient will be very angry or very sad, or he will give some reflection. Like if you break a bad news, he will be very sad. So you need to be supportive, but in a good way. Okay. Like sometime in the books I hear people give this reflection. Yes, I'm sorry for what happened. Yes, I know it is shocking news. No, actually, uh, like you don't give any feeling. Like it is like you read from the book, you just follow the script. So you need to deal with the situation like a natural situation, a real situation. Okay, if you break a bad news in the hospital, you will start to be emotional. So you need to be emotional. Yes, don't waste your time. As I mentioned, it's balance. Don't waste your time, but also don't follow the script 100% in the station. You can use different statement during the station. Yeah, I know it came like a shock for you, but we are here to help. We are here to support you. Like, do you want me to stop right now and come back again? It will not happen in the exam. He will not ask you to stop, but it is just, do you want me to give you some time? Like, and according to the station, if there is any supportive way or supportive information you can use to support him, use it to support him. Also, in situations like medical error, actually, if the patient is angry, you can support him by giving apology, even if you didn't commit an error. Okay, like sometime you will do a medical error in behalf of your on behalf of your colleague. So it is not your fault, but still the patient is angry. So you need to support the patient and to give an apology, even if you didn't commit the error. And actually, in situation like medical error, you need to give more apology, more apology. Okay, so put this into consideration. The patient sometimes will try to piss you off, so try to control your nerves. Actually, they are automated to do so, to see your reaction. So try to control the situation and try to be quiet. Sometimes you will have angry patient, like he needs some sort of investigation, some sort of examination. He doesn't need to stay in the hospital. So you need to control your nerves. You need to be quiet and to find logic answer for his question. Okay, it's not only about giving support to the patient. It is to reflect on the patient with some logic answers. Okay, and believe me, I have gone through all the PLAB 2 stations, and I know that every station have some logic answer. Sometimes people struggle to find logic answer to some question, but believe me, if you like if you tried the station try to do practice in the station 1 or 2 times or 3 times, you will start to find the logic answers for many questions. Okay, I know that I'm giving general information, but maybe after that we will give detailed information about some station. Also, one of the avoidable mistake in the exam is that the patient will give you some information that he will expect, or he expected you to give some reflection, like, oh, I had this pain since long time, and it's really affected me very badly. So because I know, because of the stress of the exam, you will start to move to the next question without giving a reflection to the patient. Like the patient said, I'm in pain, so you need to stop here. Oh, I'm sorry for what you have been through. I'm sorry for that pain. You are in the right hand right now. We will do our best to help you in such a situation. Even sometime I might ask him some question. How did this pain affected your life? And how did this bleeding affected your life? How did this tiredness affected your life? You need to ask the impact of the chronic symptom. I mentioned this before. Is very important, and it will show that you are a caring doctor. To be a caring doctor is very important. Sometimes also a part of the IBS is to deliver the news itself in a good way. Deliver the breaking bad news in a good way. Don't manipulate the patient in a bad way. Don't give hundreds of warning shots. Just give 1 or 2 warning shots, and after that, tell the result. Don't give all the information in one shot. Yes, I know that the time is very limited in the exam, but don't give the whole information in one shot. It's important to see if the patient is ready to get all the news or not. Okay. Also, in the management part, it's not appropriate not to give an answer for a situation. Yes, sometimes it is difficult to find the situation, but at least you have some differential in your mind. Sometimes people skip or just ignore to give a diagnosis. Just they think, or they think it is okay to say, no, I don't have any diagnosis in my mind. I will ask my senior to come and review. Yes, you don't have any diagnosis, but at least you have some differentials. So give some differential to the patient, and after that, yes, ask your senior to come and confirm. Or sometimes you don't need your senior. You might just need to do some investigation. Some, like in the hospital, if we suspect some diagnosis, we can't reach some this diagnosis at the moment. We'll need to send some blood investigation, and to wait until the blood result came back, some CT scan. But at least we have suspicion, so you can tell the patient this suspicion. Don't scare the patient. In many situation, I have noticed a lot of people keep scaring the patient. Like I have noticed before, like the one of the complications of this condition is this. No, it's not appropriate to say this. I don't mean like give false reassurance. No, just give true reassurance. Okay, but also be optimistic if there is any way that will solve the problem. Don't scare the patient. Give the complication of this condition in a good appropriate way. Okay. Sometimes you will have angry relative. I just need you to acknowledge that he's angry because he's caring about his relative, like his son or his daughter or his father. Just put this into your consideration. This angry relative is angry because he's caring. Okay, he's not against you. Sometimes the patient will be against you, but not all the situation. So if you thought about in this way, you will start in to support the patient, and this is the most appropriate way to deal with angry patient, to acknowledge why he's angry and to start to support the patient. Just calm him down, and after that, go through the situation. Okay. Also, from the IBS, if the patient is in pain right now, so you might need to offer him some painkiller, or at least in the start of the management, don't forget about this painkiller. If the patient had a problem right now, like show that you will go fast, like you will uh, 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 You will not waste any time to help him go through this condition. All of these are IPS. Sometimes also you will need to safety net the patient, safety net the situation. It is like safe to safety net the patient. So from the IPS also, the safety netting part, a lot of people forgot about doing safety netting. A lot of people forgot about doing follow up to the patient. Many times we need to do a follow up with the patient. Okay, like sometimes people get confused. Should I do follow up here or do safety netting? So according to the station, sometimes, uh, uh, or let me give you an example. If the station is a simple condition but could be differentially diagnosed with a serious one, so you should safety net about the serious one. Like if the patient have musculoskeletal pain in the chest, give safety netting about heart attack MI. Okay, so usually it will work in this way. Sometimes you will need to follow up with the patient, or you will need to do follow up to ask the patient to follow up with his GP regarding the treatment. Sometimes the treatment will need to be reviewed by the GP. Sometimes you will discharge the patient on a treatment and he will continue this treatment and it will need to be reviewed after that. Sometimes you will meet a patient that is reluctant to the treatment. Please tackle the situation in appropriate way, in a nice way. Okay? Like actually, first of all, you don't have the right to force the patient to do anything. Okay? And to be caring doctor, you need to find a way to convince the patient to do this. Like as I mentioned in the start, is balance between like I care about the patient. Like if I have a child, I will care about the child. So if the child refuses to take a medication, so I find a suitable way to give him this medication. Okay, so I will explain to him, but I will not push him to do so, or I will not force him to do so, especially if it is not an emergency condition. Okay, because I have seen a lot of people, no, you need to do this, you need to do that. It's very wrong that you will not take this medication. It will lead to a fatal condition. Actually, this is not the appropriate way to do it. First of all, acknowledge why the patient doesn't need to take this medication. Okay, and after that, give him logic explanation. As I said, if you tried your best in each station, you will find the logic answer for every unlogic question from your point of view. Okay, this is very very important. Also, if the patient need a referral or review by a specialist, also this is show the care. Like in Simani station, don't leave the patient in pain or in shortness of breath for a long time. Show the care, show that you are care, that you care about the patient and you are safe. So try to try to be quick. Also involve the patient. Involving the patient is very important. Will increase your IBS. Like sometime you might need to say, are you following me? Am I clear so far? Do you want me to repeat again? Are we in the same side right now? Everything is okay for you. Try to involve the patient. It is two-way conversation. The best way to do it is two-way conversation. Okay, this is important in the station, because many time in the exam, because of the stress, you will just, even you will forget some important question to be asked, so you might not remember to involve the patient, and try to make everything simple. Like if you will mention the diagnosis to the patient, don't complicate the diagnosis, or even he is not a doctor actually, because many time you will give the diagnosis in a direct way. Have carpal tunnel syndrome. Do you know what's carpal tunnel syndrome actually? From where could I know what's carpal tunnel syndrome? Okay, so you need to make everything simple to the patient. If I were in your situation, I would say you have a condition in which the nerves that supply your hand is compressed at this area. Okay, that's why you have this symptom. So and we call it carpal tunnel syndrome. So I explained everything in detail to him in a very simple way, and after that I told him about the medical conditions. It's important to give him the medical jargon, but at least before giving him the medical jargon, try to explain it, try to make it simple for him. If the patient need you to repeat again, repeat again. If the patient need you to illustrate in a different way, try to illustrate in a different way. If the patient is not like not interested in your in the conversation with you, you might need to ask one of your colleagues to come and review him, one of your seniors to come and review him. It's okay. This is simple. In the exam, try your best to be nice to the patient, and as I mentioned, they are automated. So when you will be nice, when you will deal with the whole situation as a day in the hospital, a day in the clinic, everything will be fine. Okay, that's it for now, and wait for other short videos on the IPS. Thank you.